Striving for optimal health, both inside and out. It's the High Plains Health Minute with Lacey Meeks.
Sure do appreciate you subscribing and downloading the High Plains Health Minute. Lacey Meeks, Keith Meeks, Farwell Family Healthcare, Amarillo Family Healthcare, the weight loss clinics, they do it all, and they bring you information once a week on an episode of the High Plains Health Minute that you need to know. And I want to jump into a topic, and Lacey, it's uncharted territory. Now with the High Plains Health Minute, we can. So some of these things aren't often talked about, maybe other than in that medical setting, but from a broad view first, let's talk about Votiva. What exactly is Votiva?
So Votiva is a life-changing FDA-cleared procedure for improving feminine wellness. It addresses a variety of internal and external feminine concerns with the labia, with the vagina, that you may have incurred due to aging, hormonal changes. Maybe you had breast cancer treatment and now you're having vaginal dryness. Childbirth, so many of us have been through that, and unfortunately it definitely causes some issues on our bodies long term. It's hormone free, it's quick results, and it's done in the office, no downtime.
Now let's back up. Being a man, I don't know what those concerns would be. When you say female concerns with female wellness and things like that, what exactly are you talking about? Let's go right for it. What exactly are you talking about?
Well, I think first and foremost, the external, whether it's that maybe the vagina is wrinkled and maybe it has lost its elasticity, or maybe the labia doesn't look the same after we've had babies. So the anatomy itself, looking at the picture, and believe it or not, women do look at that. It's kind of the external area, what it looks like. That makes the difference. We have fantastic before and after pictures that we can show in a consult of how much things can change in 1 treatment, 2 treatments, and 3 treatments. But aside from that, it's urinary leakage or incontinence when you laugh, when you cough, when you sneeze, when you try to jump on the trampoline with your kids or grandkids is probably the most, that's the biggest thing I hear.
Sure.
But also, wanting some vaginal tightening because they have had those vaginal babies and they've lost some of that elasticity internally. But really the incontinence side of it and the external and the internal look and feel are what women are really looking for.
Now, I would imagine if you're listening to the podcast right now, it might be a little bit of an embarrassing thing to bring up with your healthcare provider, but it's something that you shouldn't be embarrassed about because there is this procedure, Votiva, that can help. What exactly is going to happen if someone comes into your office, Lacey, in Amarillo or in Farwell, and they bring this up? What's going to happen? What happens next? What do you tell them?
Well, myself and my staff are highly educated on the subject. We've dealt with it for a long time. We've done a lot of procedures. Number one, there's no embarrassment in our office. There's no judgment. Listen, we've all been there. We've seen people who have been there. It is just so fulfilling to help those patients and see the outcome of it. It's very discreet. It's very private, essentially painless, and again, no downtime. So they're going to come in for that consultation. We're going to visit with them. We're going to talk pricing. We're going to give them a flyer and answer any questions. And our office, as most people who have been there can probably agree, we're no pressure. You don't have to come in and think that we're going to take all of your money and make you sign up the day you come in. We're happy to answer those questions and do a consultation first. And then if you want to make that decision, great.
Are there varying levels of the procedure? Is there, if you're coming in and you're having urinary incontinence, obviously that is one symptom that can be treated by this. If you're coming in because elasticity isn't what it once was, and you're going to want that, but maybe you're not having the urinary incontinence, are there varying levels of how people are using Votiva?
There are. So we have the Votiva itself, which is the one for the internal, and it also treats some of the external. But we also have the Forma V and the Fractura V, which are different parts of the Votiva machine itself. So it can treat the external tissues, which is where we're looking to kind of shrink that back up, the internal and the external labia. But also, it's kind of aside from the vaginal side of it, the Fractura also will treat the face. So it's microneedling with heat and radio frequency for fine wrinkles and aging more gracefully, I would say. So it definitely, this machine does more than just one thing.
Yeah, for the women out there that have done this, the vampire facial's been the big thing for them. This is almost the vampire facial on steroids.
And I remember you guys telling me at one point, I think I was in your office, and one of you said to me, there are parts of the body that age just like the face does.
That's exactly right. I always say the genitals age like the face does. So it's something that is maintenance. You do 3 treatments of the Votiva 1 month apart is kind of the treatment plan for most patients. And then once a year, because you're right, the genitals are going to age just like our face does. We just don't always think about that.
So as far as long-term results, once a patient goes through the initial 3 treatments, at that point, then they're looking at once a year, they would come in for another treatment.
Exactly. And I'll tell you that not only do the patients notice a change even after the first treatment, maybe in the urinary incontinence, maybe in the tightness, but a lot of times the partner even notices that change.
Sure. And so let's talk about that. What are you hearing from patients? Obviously, you can't speak to someone specifically, HIPAA laws and things like that, I get it. But from a broad view, what are you hearing from patients? It's such a new idea, Votiva, to most. Not to you, you guys are experts on it, but to most, what are you hearing from patients?
Our patients are doing great. We actually have gynecologists that are recommending those patients come do this treatment before they do bladder surgery. Now, listen, I'm not here to tell you that you don't need bladder surgery. I'm not the one who needs to make that decision. But I do know that so many people would much rather try that than have to undergo a surgical procedure, with deductibles and things like that. It becomes a little bit pricey downtime. So after even 1 treatment, I'm seeing a change in urinary incontinence for most women. I have one lady who has completed her series of 3, and her grandkid says, Grammy, you don't have to pee on yourself anymore because you can jump on the trampoline with us.
Now, to her and what she's saying, though, there's a lot of gynecologists out there that are referring patients to get this done first, especially the ones that have this machine in their office or a machine thereof like it. They're definitely trying this first.
You have to look in that particular scenario that the grandma you were just talking about, where a grandchild says, Grandma, you're not have to pee on yourself any longer. Although that seems, it'll put a smile on your face because kids say the darndest things. What does that do for the confidence of that patient, for that woman, that somebody maybe have noticed that had been happening before and now it's not happening anymore? There has to be ancillary benefit to it as well.
Absolutely. And they're not having to walk around maybe wearing that panty liner and they're like, it feels like I'm wearing a diaper. Or their grandkids have said to them, are you going to have to wear a diaper, Mimi? Because they're leaking. They can't make it to the restroom on time. They're having to stop 4 or 5 times as they're traveling. All of those things, but also vaginal dryness, particularly in the postmenopausal woman or the woman who's been treated with breast cancer who maybe doesn't get estrogen therapy. It really helps with that vaginal dryness.
Let's talk about any side effects. We've talked about the pros of Votiva. By the way, it's spelled, if you want to do the research, Votiva. It is available at the clinics offered up by Lacey and Keith Meeks in Farwell and in Amarillo. Let's talk about any side effects of Votiva.
I would say that's probably the beauty of Votiva. It's essentially painless during the procedure. You may feel a little bit of heat and, maybe just feeling that wand go around. And it takes about 20 to 25 minutes, kind of depending on the patient and how much treatment's needed. But there's no restrictions as far as intercourse, as far as your everyday activities. There's no restriction, no downtime. There's no medication involved. So you don't have side effects. You're not going to have issues with that. And I get the question a lot. What if I already have a bladder mesh? What if I've already had bladder surgery? You can still have this procedure done because many of those patients are still struggling with the urinary incontinence after having that procedure. Or maybe it was years ago they had that procedure done.
They're suffering from other things that the vaginal mesh had nothing to do with.
Are there patients that this is not right for?
I wouldn't say there's any contraindications, actually. I haven't run across any contraindications. Obviously, if you've had recent abdominal surgery, vaginal surgery, maybe it was a vaginal hysterectomy, maybe you've had a vaginal birth, we would not want to do that right away. We need to give the body some time to heal. That can be discussed in the consultation. If you've had a recent surgery, we can talk about how long we need to wait before that treatment happens. So that would be a contraindication initially, but certainly down the road it can be done.
We mentioned just a short while ago what the ancillary benefit would be. Self-confidence obviously falls into this. If you go through the Votiva procedure, you see the results that come from that procedure, it's going to help with self-confidence. Are you finding that, let's jump into a different area. Are you finding that partners of those who are either potentially already going through this or would be a candidate for this, are they saying anything about the procedure?
Absolutely. They can definitely tell a difference in that elasticity, that tightening after the first treatment, but certainly after the third treatment. You can already tell a difference. But I would say for women themselves, as far as self-confidence goes, the external, looking at it externally, maybe they had a lot of loose skin and they had a lot of elasticity issues and they were thinking about even a labiaplasty, which certainly can be painful and definitely have some downtime with. This may be an option or an alternative to that. And that self-image for those women who are struggling with that has made all the difference in the world.
Would you say that it would be beneficial to try this first before
Absolutely.
you try that?
Price-wise and pain-wise, I think it's definitely an option. And again, we have before and after pictures that we share with those patients that are interested. Of my patients, these aren't just a stock image,
Men have come up and said, I can tell a difference. Physically being intimate with my wife, we can both tell a difference.
Sexual satisfaction has definitely been, for both men and women, a benefit.
It starts with a conversation. It starts with learning more about the procedure. Again, it's called Votiva, Votiva. If you want to learn more information, 2 websites for you to consider. LaceyMeeks.com, LaceyMeeks.com. The second website, AmarilloMedicalProviders.com. String it all together, AmarilloMedicalProviders.com. The last 2 episodes of the High Plains Health Minute, we've focused primarily on women's health. In episode 5, we discussed breast cancer awareness, risk factors, and things that you can do to stay out in front of it. We've learned about Votiva in this episode for improving feminine wellness. In the next episode of the High Plains Health Minute, we'll focus on you guys, specifically the dreaded erectile dysfunction. It's real, and in many cases, it is manageable.
The High Plains Health Minute podcast provides general information and discussion about medicine, health, and related subjects. We make every attempt to provide accurate and up-to-date information, but medicine is an ever-changing landscape. The words and other content provided in this podcast are not intended and should not be construed as medical advice. If you have a medical concern, you should consult with an appropriately licensed healthcare provider. The information presented on this podcast are the host's personal views, opinions, and research on the subject matter.